The average number of daily new COVID cases in the U.S. from Omicron has finally dropped below the peak of the Delta wave. But the country is still averaging more than 145,000 new cases and 2,400 deaths per day. This has left people with many questions about balancing risk and safety. John Yang is here to get some answers.
Judy, this afternoon, Virginia's governor signed into law a measure requiring public schools to make masks optional starting next month. It's the latest state to ease indoor mask policies. And with the CDC reevaluating its guidance, some are asking whether COVID precautions are being rolled back too soon. To address that and more, we're joined again by Caitlin Jetelina. She's an epidemiologist at the University of Texas Health Science Center's School of Public Health in Dallas, and she writes the Your Local Epidemiologist newsletter. Caitlin, thanks so much for being with us again. This goes right to our first question. This issue of mask policies goes right to our first question from a viewer. Nancy Eichelberger from Plainfield, Illinois asks quite simply, why is unmasking safe now when transmission is still high?
Oh, this is such a good question. And the truth is, this landscape is changing throughout this pandemic. More and more people are getting vaccinated, and vaccines are the best tool we have right now, but they aren't perfect. And so I would actually agree with Nancy that I think that transmission in the community is really high right now. In some places, it's higher than the Delta wave still. And we really need to slow down and wait until transmission is controllable in a community before we take off our masks.
Is the best advice or the best guidance local advice? I mean, today, for instance, at the White House briefing, Dr. Walensky, Rochelle Walensky of the CDC talked about conditions at local hospitals being something that they need to consider when making local recommendations.
That's certainly the direction that we've gone in the United States is this local response. I certainly think, though, the local jurisdictions need guidance. We need to know what those metrics are so we can guide populations on when it is safe to take off masks. That guidance has not been defined. I hear rumbles that it may be defined next week, but people need to know now. And we really need to standardize this across the nation so the message is clear and people know what to do.
We've got a multi-part question here from Niles Holland of Omaha, Nebraska. Could we see another variant that's more contagious and has a higher morbidity rate than what's currently out there? Or is Omicron essentially the watermark variant of the pandemic? If so, are we done with the waves of infections?
Yeah, these are amazing questions. In general, we don't know what the next next mutation is gonna look like. Contrary to a popular belief that this virus doesn't necessarily mutate to become less dangerous. The mutations are random. The only thing the virus cares about right now is surviving. So we only know that the next big mutation, if we get another wave, will mean that variant is more transmissible. It could be more severe. It couldn't be more severe. We don't know. It's a crapshoot. And so that's why it's really important that we prepare and we are ready. We prepare for the worst and really hope for the best.
Kelly Reif, or Rife, I apologize, Kelly, from Glen Rose, Texas, has this question. What do we know about helping people with long COVID, specifically the smell and taste disorders that are so difficult to deal with, lasting many months?
Yeah, the first answer is we know long COVID is real. There's an estimate between 10 and 30% of adults that get infected will have long COVID. And so what that means is we're having clinics open across the nation and across the world to try and understand how to treat it. There is really new evidence coming out in the past week showing that predictors of who may be more susceptible to long COVID and who may not be. The more clues we can get from the science, the better, because then we can treat those patients, maybe with antibody infusions, maybe with some antivirals or other medications.
Do we know whether severity of the initial infection is an indicator of whether or not someone's going to have long COVID?
So, not necessarily. Some people that have even asymptomatic disease will end up getting long COVID a month or two later. And so, we really think that genetics plays a role in here and even maybe some hormones. But again, we're still trying to identify who gets long COVID and why so we can better treat them.
Molly Smith of Boston has a question that I think is on the mind of many parents of young children. When will a vaccine be available for children under age 5?
Yeah, I am a mom of two under 5 as well, and I have been waiting desperately for this vaccine. Unfortunately, it looks like, we'll be getting data in about April. So maybe May, maybe early summer, we could see this vaccine. What's really important with this clinical trial is that one, the vaccine is safe for our kids, but two, the dosage is much lower than for 5 to 11-year-olds. And we really need to make sure that dosage is effective. Because if it's not, then we need to figure out another plan. And no one has seen that data yet, except a few select at Pfizer and FDA. And so we're all really looking forward to seeing that data so we can assure that these vaccines are effective for our little ones.
Epidemiologist Caitlin Jetelina, so informative as always. Thank you very much.
Yeah, thanks for having me.